I'm Lawton Snyder. I'm the CEO of the Eye and Ear Foundation. So we support research to advance care for vision, hearing, balance, voice, and cancers of the head and neck at the two world-renowned departments of ophthalmology and otolaryngology at the University of Pittsburgh. The funds we provide from the Eye and Ear Foundation to support research are only made possible because of philanthropic support. I know many of you know that, and I want to thank you, those who have supported us in the past, but welcome everybody, of course, on to today's webinar, which is open to the greater public. Little housekeeping, chat is disabled for our webinar series, so just not to confuse you, but you can please ask questions, and you do that by typing a question into the Q&A function on your screen. Please refrain from asking personal health questions. What I'll probably do if you do is hold those to possibly get back to you later, but we'd rather you just email Mr. Craig Smith any personal health questions. But please ask questions that you think that the rest of the audience would be interested in. And please feel free to use the subtitle function for closed captioning below. We make that available for all of our audience, and particularly our listening impaired audience. We will be adding people who are new to our webinar series to our email list, but you can certainly let us know if you'd like us to take you off at any point. But glad to have everybody here, and very, very happy to introduce this program. And I'm going to let Dr. Sahel introduce the speaker. So this is the topic today is digital twin of the eye, and I know you'll find it fascinating. It's always one of my favorite topics to explain to somebody how we're doing this, and it's really again the brainchild of the people you're going to be talking to, you're going to be hearing from here in a minute. So first, let me introduce Dr. José-Alain Sahel. It's good to have Dr. Sahel here with us today to introduce today's program. He is the Distinguished Professor and Chairman of Ophthalmology in the Eye and Ear Foundation Endowed Chair at the University of Pittsburgh School of Medicine. And he's the Director of the UPMC Vision Institute and Emeritus Exceptional Class Professor at Sorbonne University, Paris. Dr. Sahel, great to see you, and tell us what we're going to hear about today and who from.
Thank you very much, Lonnie, and thank you for attending. This might look as a very cryptic name. Actually, people working in industry have been working on digital twins for decades already, and this is a concept that has helped considerably to perform better and to better analyze the data and really help in making the right decisions. So the goal of this approach is to integrate all the information we can gain from listening to our patients, assessing anything that is around their general health, social determinants of health, which you heard about many times in these webinars, but more importantly, all the clinical data that we are collecting when we are seeing the patient in the clinic, all the history, all the previous history, and all the symptoms, and the imaging. In ophthalmology, we are very fortunate. We benefit from extremely precise imaging technologies that are now reaching the cellular level, and this is producing a lot of information. So the way we do medicine classically is unable to really integrate all this information in a way that would really ensure that we don't miss any important piece. And the concept is to integrate a model of all the information we are getting from every single patient into forming a twin, a digital twin of a patient that is really recapitulating all what we can learn. And based on what we are learning from the individual patient, but also from previous patients and all the databases we have had, and using what we call artificial intelligence and machine learning, we're trying to extract what is the most meaningful and assist the physician. It will never replace a physician. It will never, especially a retina specialist, for example, because a lot of it applies to retina, but not only. And this is helping in making the right decision, helping in also showing to the patient what is expected. If we do nothing, if we do this type of therapy, what are the expected outcomes, which mean the clinical results, and to help in making the best possible decision. And because this is a learning system, all the information is being collected, and this information can help to assist in the future. So it's a very complex process, and I was very fortunate when I came to Pittsburgh, because I had started that back in Paris, but I was able to recruit Jay Chhablani, and around him a team of very experienced people, expert in both retinal disease, imaging, and artificial intelligence. And we were fortunate also to get the support from important foundation, the Eye Foundation, the Hillman Foundation, the several others that we will describe over the course of a discussion, especially the Shear Foundation, to really develop this model of a digital twin that is helping us in trying to make the right decisions in a very systematic way. So Jay Chhablani, who is really leading all these efforts and leading also clinical research in our department, with a very seasoned retinal physician and surgeon, is going to describe the approach to you in the next minutes. Thank you very much.
Thanks, Dr. Sahel. Hello, everybody. I'm Jay Chhablani. I'm retina specialist. I have a keen interest in imaging and artificial intelligence. So I'll take you through this journey of digital twin, which Dr. Sahel just briefly described. And I always say that we are lucky that Dr. Sahel shared his vision with us, and we are able to move forward towards treating our patients in a much better manner with all the help from Eye and Ear Foundation as well. Let's move on to the presentation. So what we really want to achieve when we treat every patient? We really want to offer them an individualized treatment for that particular patient, and also to monitor and make sure that the patients are safe with whatever treatment options we are giving. So to solve this individualized treatment and safety monitoring, we believe that digital twin is the key behind all this learning. So what we are trying to achieve is that enriching the cohort or the number of patients, and then it will also help us to speed up the time as well as the model diversity, because I'll take you through the amount of data we have, which is helping us to truly bring up the digital twin to offer an individualized treatment safe and as well as monitor the patients. So how do we actually achieve digital twin? So when I really think about digital twin, we decided to split it into 5 pieces: AI-based image analytics, clinical analytics, the quality, advanced imaging, as well as social determinants of health. So I'll take you through each of these pieces one by one and at a slow pace, because I know it is a very complex process, but you will realize that how we are trying to put these things together to create a digital twin for an individual patient, which will help us to offer them the best treatment option available. Let's start with clinical analytics, because as you understand that the data is the new oil, we all know that the data is very important. So therefore, with the help of clinical analytics teams of UPMC, led by earlier by Dr. Morquin and now by Dr. Suresh, we are really working very closely with them, and they have helped us to develop this um, app where we can actually see all the details of our patients, which patients are coming to the clinic, how frequently they are coming, how are the emergency visits, what is the gender distribution, ethnic distribution, which office did they go, which zip code do they live. So you can imagine that this is actually the whole data about every patient, which we can steal from this clinical analytics tool, which we developed. And we have been really lucky to work very closely with the clinical analytics teams, who are able to provide us all the possible information, not only about the ophthalmology, but also about their systemic disease, and including all the demographics, as well as various factors which can influence the ophthalmology outcome. Let's move on to the second piece of digital twin, that is AI-based image analytics. That is my area of interest, and I've been fortunate to work with these two gentlemen, Kiran and Sandeep, who are PhD in machine learning as well as artificial intelligence, and we have created a niche area in UPMC, particularly in Vision Institute, where we have these AI experts working very closely with us. and we have been developing really interesting technology to treat our patients. So let me show you more detail about this segment. So before we really get on to the broad picture of digital twin, it is very important to focus on one disease. And for our research, we picked up a disease called AMD, which I'm sure many of you are aware that this is one of the most common cause of vision loss, particularly in the Western world. Macular degeneration, which is age-related, is a degenerative disease which affects the macula of the retina. As you can see that the macula is the central part of the retina, which is responsible for high acuity central vision. So macular degeneration is affecting more than 170 million um, patients across the world. More than 10 million are in the US, and we believe that this number is going to double by 2050. And the risk increases with age, because as we know that as we all are getting old, we have a higher risk of developing AMD or age-related macular degeneration. And we believe that more than 75 years age, approximately 30% patients have macular degeneration. And it costs around $350 billion as global cost. And out of that, 75% is direct healthcare. So this really sets up the stage that AMD is something which we are really concerned about. And before we really get into the details of imaging and the image analytics, let's understand what kind is AMD. AMD could be of two types. One is dry AMD, as the picture shown in the left. This is a color photograph of a patient with dry macular degeneration, where you can see that there is a thick, there is an area of a patch thinning of the retina right in the center, and this is why the vision is lost. And you can see the OCT scan, which is a cross-sectional scan of the eye, which we obtain every visit for our macular degeneration patients. And here you can see that how the retina has thinned out in the center, and you can imagine that this patient has barely any ambulatory vision. What about wet macular degeneration? As we just discussed, the dry AMD, there is no blood, but there is thinning of the retina. But in contrary, wet macular degeneration or wet AMD has this subretinal hemorrhage, or you can say that there is some retinal swelling, which is the cause for vision loss. And before we really get into the details, you should know that the wet macular degeneration has both the diseases has been there for many, many years, but the treatment for wet macular degeneration has been around for more than 2 decades. And now our patients as well as physicians are very comfortable treating this disease, where we have to offer monthly injections or 2 monthly injections. And there is a lot of research has been happening in extending the treatment as well as improvising the treatment outcomes. The dry AMD is I would say is much more challenging, because so far we did not have any treatment for dry macular degeneration, and it is very much painful to see that patients are gradually losing vision, but we are not able to offer any treatment. However, in last year, we have now 2 injections approved, which can prevent the slow down the progression of this disease. So that means that if the central area is going to get affected in dry AMD, say in 5 to 7 years, with these injections, we are able to add 2 or 3 years of good vision for these patients. As you can understand, that this is still not the best treatment. We still are trying to improvise the outcome. Is there a way we can prevent for any progression? However, we don't have any other treatment, so we are offering such treatment for our patients, where the patient has to undergo monthly injections to prevent further vision loss. Let's move on to the more complex problem. So as you understood that there are challenges of dry and wet macular degeneration, where we have limited treatment options. So what my lab is focusing primarily on screening for macular degeneration as well as predicting the progression of the disease. Because as you can understand, that if you can diagnose the macular degeneration way early, then we may be able to prevent the vision loss. We may be able to extend the good vision life for our patients. And what about the prediction? Because we really want to understand that how this patient is going to respond to the treatment, when this patient is going to convert from dry to wet macular degeneration. These are some of the questions which we really aim to target through our research. All right, so before we really show you what we can do with it, these are small pieces which we had to really put together. Don't worry, I'm not going to take you through each of these small blocks, but I just wanted to show you the complexity of the problem, that if you just want to achieve the prediction of macular degeneration, there are so many pieces which we are trying to put together. And with the help of Eye and Ear Foundation and Shear Foundation, we have achieved quite a bit of this, which I will show you some of this work we have done. Let's jump on to the AMD screening. What we really want to do for macular degeneration is that we really want to take the macular degeneration to the community where the patients are being screened for macular degeneration instead of being diagnosed by their optometrist for the first time and then realizing that they have already lost vision and now there is no hope, or there is some treatment which they have to undergo monthly to prevent further vision loss. So what is our goal is that, we should have algorithms which we would like to identify these macular degeneration patients in the community, where we really want to take our technology to every space, every community places where we can start screening for our patient. So this step is one of them. So what you are seeing here on the slide is that these white blobs which you are seeing on the machine on this image, these are the blobs which are present called drusen in the patients with macular degeneration. And this image is created by a routine OCT scanner, which we obtained for our patients. So goal of our research was to identify these blobs, which will help us to diagnose macular degeneration before they are advanced to this stage. So by using the AI techniques, we are able to segment these blobs. And when we started comparing these with the ground truth, and you can see that our algorithm is doing really good, almost with 0.86 or 80% accuracy. And we believe that we can improvise this further. And then we will be able to start diagnosing our patients in the community. And just imagine a day where you can actually walk to Costco and Walmart and get the macular degeneration screening done during grocery shopping. So something like this we are aiming for our patients. And let's talk about geographic atrophy, which is a much more advanced form of macular degeneration. And here you can see that there is a patch right in the center, which is the thin retina, and this patient has already lost significant vision. And we wanted to identify this in an automated fashion. And here you can see that our algorithm is able to segment the lesion, and then we believe that we will be able to predict how this progress, which I'll show you in a few minutes. So let's talk about macular degeneration prediction. Whatever we learned with these last two slides, we wanted to apply it for the next patients. So before we really get on to the wet macular degeneration images, I just wanted to share some of our early work, which we did help with the Shear Foundation as well as with Hillman Foundation, where we actually wanted to predict that what are the possibilities for the fellow eye converting into wet macular degeneration. Let me explain to you a little bit more. So we do get a lot of patients who are coming for injections in one eye. The commonest question which I get to hear from our patient is that, doctor, when do you expect my other eye will require injections? Or when do you expect that my other eye, which is dry now, will convert into wet macular degeneration? So we really wanted to put together an algorithm to predict what is the possibility. And this is some of the initial work, which is still we are still working on it further to improve the algorithm. And here this video can show you that just by using the demographic factors and some of the social determinants, we are able to predict the wet macular degeneration conversion in their fellow eye. And here you can see that there is an AI model which is predicting almost a 95% possibility of not developing wet macular degeneration in 3 years. So we are really aiming to merge the imaging information into this model and then predict to make this model much more stronger and to predict the conversion rate, to predict the progression rate. So this is another wet macular degeneration prediction. Here you can see that this is the imaging part of it. where you can see that this is a scan from a patient with wet macular degeneration. And the question here was that can we really predict how this patient is going to look after 2 years? So this is what our models have predicted, that this patient is going to progress and have some scarring with continuous treatment. And we wanted to compare with the real life year 2 data. And here you can see that our models are actually almost reaching to the similar accuracy, but we are still working on it by feeding a lot of data to come up with much more accurate and validated software, which I'm sure that in next few years, you will get to hear something like this very soon. This is our dry macular degeneration prediction, where you can see that this patch of geographic atrophy is there in this patient right in the center. So we want to understand that how this patient or how this lesion is going to progress. And this is again a very important question to answer, because many of these drugs which are being developed and they are already approved, the question always is that which patient is going to get benefited with these treatment, and what kind of treatment can we offer to our patient. So this is where we are like, we are still taking the baby steps of predicting how an individual patient is going to progress. And this is what we achieve by just using the images. We are able to synthesize these images, that how this patient is going to look in 2 years. And if when we compare with the real life data, here you can see that our models are able to predict that this patient is going to progress. However, we believe that still we have to improvise these models to get closer to much more accurate information. So this is our vision. This is exactly what we really want to achieve, where we want to talk about that for a given patient, which patient and when this patient is going to convert into coming years. And here is some of the work which we are working, we are really trying to achieve in next 6 months to 1 year, is that where we can actually put these patients' data and talk about when this patient is going to convert. For example, this is an example of one of our patients where we can say that, this patient has a 50% chances of conversion by September 2025. So this is something which we really want to talk to our patients when we see them, that, if you do not take any treatment, there is a possibility of progression by this percentage. If you take the treatment, this is the possibility that, we will be able to save your vision. And here you can see these various parameters which we are coming up, that, when you have your foveal involvement, and fovea is the centermost area, which is responsible for vision. And we want to really predict that when this central area is going to get affected. And just by putting these graphs, we will be able to talk and forecast the progression. And this is the goal at this point. So let's go back to the digital twin. And as you saw, that the previous section was primarily my research. So I'm very excited about it. And so I spent a lot of time onto that. But let's speak the rest of the pieces which are becoming very important for our digital twin. So the next piece which I really want to talk about is the advanced imaging. And we are lucky to have Dr. Ethan Rossi, who is leading our advanced imaging lab, where he has multiple tools. And I work very closely with Ethan, where we are trying to really go to the cellular level for these, particularly for these macular degeneration patients. And we are trying to image these individual cells and predict that how this all is going to go further. And Ethan also has a very special expertise in imaging one of the very important layers, that is retinal pigment epithelial, by using near infrared autofluorescence imaging, which is something he is considered as one of the experts. And he also is working on ganglion cell layer. He works very closely with our uveitis specialist. And we are trying to bring all this imaging data, what you saw earlier, the clinical data, as well as imaging data, including this high resolution, into building up this digital twin. Let's move on to the next piece of social determinants. Social determinants of health is a very interesting and a very important piece of today's healthcare. And these efforts are being led by Dr. Andrew Williams, who is a glaucoma specialist in our team. And he is primarily focused on the social determinants of health and trying to understand that which kind of social determinants can predict the progression of the disease as well as response to the treatment. So let me tell you what are SDOH. SDOH are pretty much the social needs and the circumstances which affects the health and the well-being of the patient. Because there are many factors around us which we may or may not be able to change. However, they still affect our health outcomes. And this is why the SDOH is becoming a very crucial component of every treatment modality which we are coming up. Because we believe that SDOH are predictive of less. There are studies which have already been shown that the SDOH are predictive of less access to eye care as well as poor visual outcomes. And we believe that understanding social factors is essential to understand the course of the eye disease. And Dr. Andrew Williams has put a lot of efforts in evaluating these various determinants of social care, social health, where we are enrolling where we are collecting all the data when the patient is being seen in our clinics. And these results are now being entered into the electronic health records to facilitate the referral to resources and provide opportunities to incorporate social factors and disease modeling. Before I really move further, I wanted to bring up one very important component of the social health where Dr. Sahel has taken extra mile to bring up one of our uh, uh, administrator whose primary job is to actually look into the patients who require special help to undergo treatment in terms of working with the insurance, working with their reimbursement, working with their transport, and every small piece which can actually affect the visual outcome. So I think that this component is very, very important for our patients. Let's move on to the next piece of digital twin, which is the quality. I think the quality is a very broad term, but it is very, very important. And these efforts are being led by Dr. Janji, who is a cornea specialist, but also taking care of the quality component in our healthcare, because we really want to understand that, okay, we have imaging, we have clinical data, we have high resolution imaging, but when we really bring our patients to the hospital, what is the actual experience, what they have, what is the quality care we are working on, for example, that what kind of complications are there of the surgery, how much delay has happened. So Dr. Jhanji is very much focused into the quality improvement in our efforts, along with um, Ms. Wellenker, who is helping him with the quality improvement overall in our department. So what are the applications in quality improvement? We really want to understand the operational strategies, capacities, staffing, as well as care models. They work very diligently to identify the areas of improvement and predict the future challenges, because if you are expecting that your patient workflow is going to increase, then we had to really start working towards offering better treatment for our care with the same quality. So we really work very closely to optimize the organizational strategies to improve the outcome, as well as the most important is to reduce the breakdown, because as you can imagine, that such big healthcare system when we are running, there are always risk of breakdown. So by constant quality improvement, we aim to reduce the breakdowns. Let's move on to the last part, back to the same, that by listening to all this, you realize that to offer individualized treatment for our patients, we truly require all these pieces to put together to improve the outcome and also the experience for our patients. With this, I would like to acknowledge all the support from Eye and Ear Foundation, to Hillman Foundation, Shear Grant support, as well as Research to Prevent Blindness, as well as our NIH grants who are helping this efforts for our institute. Thank you so much for your attention.
Okay, thank you so much, Dr. Chhablani and Dr. Sahel. This is it's a very interesting topic, and it's something that I think is, for a lot of maybe our audience, is something so totally new. And maybe to get your heads around it, just imagine that you're going to your doctor's office, and you're somebody who is newly diagnosed or is concerned about, your health of your eyes as it relates to something like macular degeneration, this is really a tool for that, right? It's a tool to kind of understand the progress, the progressive modeling, or how this disease will progress over time, so that you can sit down with your physician and have a more educated or a more informed discussion about the future of your health and maybe some better ways to consider those treatments. Does that summarize it, I think, in one sentence?
Absolutely, absolutely.
Yeah, and it's also, I think, a powerful statement on where things are going in healthcare. We hear a lot about artificial intelligence and machine learning, and the impact of what that can have on our health. That's exactly what we're doing here, right? We're applying those tools to a lot of different data about a person to be able to really understand how each person is different in terms of their health, and how each person is different in terms of how their condition may progress. And what a wonderful way to use a tool like artificial intelligence and machine learning. Thank you. And I know we have lots of questions. I hope that one, I think, gets answered here, that this is a new tool. It's something that can be applied. Right now, you're looking at macular degeneration, but I know there was a question earlier, is it applied to other types of retinal conditions or other conditions in general? And the answer is,
yeah, it's a universal model. I mean, it's an approach. I mean, the tools are the same, but the system is adapting to every condition. So actually, we are also working on the retinal degenerations, and there are people in the department like Dr. Janvi are interested in cornea. So it does apply to all the care in the eye. And as Jay Chhablani emphasized, it's also a tool for quality of care. So we have this partnership with the Jewish Healthcare Foundation and Pittsburgh Foundation to apply that as a continuous monitoring tool for the quality of care, making sure that we provide what we believe is going to be the best to the patient and checking that this is happening. So we have an engineer who is specialized in the quality of care, Dr. Velanka, and she is part of a team working with Dr. Janji to really monitor that we are adapting these tools to assess continuously. As we discussed, it's a learning system. So every time we apply it, we are learning from the performance, how it's working, the feedback from the patient to make it better. So currently the model that Dr. Chhablani showed is for age-related macular degeneration, but we are already working on other conditions, diabetic retinopathy, genetic disorders, for example.
and and another question, as it leads into that, is it, this doesn't necessarily have to be limited to the eye, right? If this technique, and is there any work going on that you're aware of in other departments that's following a similar type of progressive modeling, maybe for cancer or for other diseases?
Yeah, absolutely. And I think that there are multiple areas of healthcare which are introduced, or they have introduced, like Dr. Sahel said earlier, that this digital twin has been there for more than a decade now. And I think that a lot of other specialties are making use of it, particularly the cancer. So I think the only challenge with these things is that, the developing technology, the AI models, as well as the data. So the more data you feed in, the more accurate the information will be.
Excellent. So, and then as far as how this tool is being used in other ways, will this tool evolve to take into account new therapies that a patient will have access to, such as a new drug, or how effective those new therapies would be?
Yeah, 100%. And I think that the reason and the goal, what we are trying to achieve is that, come up with more imaging biomarkers, which are going to eventually help us to identify these diseases much earlier and identify the treatment response with the newer treatments as newer therapies as well. So, and I think this all goes like literally in a vicious cycle, and you keep learning, you keep evolving.
So, do we know if any other departments for ophthalmology around the country, is anybody else doing something similar that we're aware of?
No, I don't think not in terms of ophthalmology. I doubt anybody else is doing, but other than ophthalmology, there are a few fields which have applied, but we are the only one who are trying to merge all these together in the country and in the world, I would say. Right, Dr. Sahel?
Well, of course, we cannot be aware of everyone else what they are doing, but several teams are working on artificial intelligence, adapting that to imaging. What probably is more original is that we are trying to integrate every parameter, like social determinants of health, history, medical history, many other things as part of that. So this might be a bit more original. I had started that project when I was in Paris, so the team in Paris is also working on similar ideas, but I think now we are really with a team that was formed around Jay Chhablani, we are in a very good situation, especially because this has been implemented already as a pilot for several years, and now we know how it's working. And because it's a learning system, it's going to continue to improve over time.
And and is it
We have just I forgot to mention also other centers have contacted us to collaborate with us. So the goal is really not to work in isolation, but really to share the knowledge, because the more data you integrate, the more experience you get, and the more patients are involved, the better it's going to be.
wonderful? And you know, I know that the plan is for this to be used as a tool in the clinic. Will there be clinical trials first, or is there something that you know that or will this is this something that will be implemented in otherwise through patient data and so forth? How's that rollout of this going to work in terms of the medical system?
Very interesting question, and I think that you actually stole really a great idea, which we were talking about with Dr. Sahel a few weeks ago, that now that we are at a stage where we are able to identify these patients by using all the things which I showed you, the sum of the pieces. So we are actually going to apply this in both levels, clinical trial as well as in the clinics, because clinical trials will help us to identify the right patients. We will be able to identify the best patients for a particular trial, because as you guys are aware, if we really talk about macular degeneration, that we are lucky that, you know, in Pittsburgh area, we are the only one who are able to offer the most advanced gene therapy trials for not only for macular degeneration, but also for inherited retinal diseases. And we believe that by using artificial intelligence, we will be able to identify these patients and then recruit them for the trial, which are the most beneficial for our patients. So that is one part. And the second part is that I always envision and tell my patients that one day there has to be a software right in the computer where I'll just on a click of a button, I'll be able to tell you when your other eye is getting converted and when you will require injection. And I feel that we are not that far from that. So we are reaching there. And I believe that, you know, this is exactly what we all believe, that, you know, for our patients, what if we are able to predict that how they are going to progress, and you can really estimate the timeline, start talking about the treatment options, and this is the future.
As it relates to research in general, is it have applications there as well in terms of even studying, those new drugs or those new therapies and sort of having a hand in helping us understand the usefulness of those new therapies?
Uh, yeah, because, you know, at the end of the day, when we are when we are getting the data from real life clinics, we are anyway evolving with the models, which will really segregate all these patients. And as probably many of the audience are aware that our basic science team is huge since Dr. Sahel has come, that, you know, a lot of innovations is going on, and we are hoping that some of the therapies which are being developed here in Pittsburgh, in Vision Institute, we will be able to apply and test them right here through our clinical trials. So I think this all is going to merge together in a few years, where we will have therapies which are being developed here in the Vision Institute, trials which are being run in the Vision Institute, and this is the future. And I think that Dr. Sahel would really like to talk about that he's leading almost 35 centers for one of the inherited retinal diseases as the trial head, right, Dr. Sahel? You want
Yeah,
to
we
share
have
something?
this big universal study on rare diseases, but where we are following all patients affected with that, with the support of Foundation Fighting Blindness across the world, 35 sites. And something I want to say, so we have already all the gene therapy trials here, and we are developing more that are just running. And the digital twin is already implemented in the clinic in part for the imaging, is implemented also for the quality assessment in part, but the full scale is going to be implemented over time. But we already have several components of it that are already embedded into what we do. And Jay Chhablani has been able to work with the analytics department to really connect that to what we do in real life.
So I see one question here, and I think it's relevant maybe for others that are on this as well. I want to know how to get involved in clinical research here at the University of Pittsburgh, and I know that there's a national website for people to go to, but soon we will have more information on the department's website as well. But where would Dr. Chhablani, I know this is your area. What would you advise people who want to know about the research that we're doing?
So I think that Loni's team is already getting ready to roll out our website maybe next 2 weeks. And the website, we are aiming to make it so comprehensive where patients will have access to the clinical research component, the clinical trial component. And on the clinical trial website, we are aiming to put all the clinical trials which are active and recruiting, and there will be a direct contact number. And if any patient wants to get in touch with me, feel free. Loni, feel free to share my email address. I can connect them with the right people and direct them to the right investigators. And, we will be happy to talk more and more about what we are doing here.
Oh,
Absolutely.
thank you, Dr. Chhablani. And the website that you're referring to is the Department of Ophthalmology website at the University of Pittsburgh, just so
Yes.
everybody who's going to be looking for it. It is being updated. The official update will be provided by mid-December. It'll be up and running. So for anybody that's interested, this is an evolving story with the digital twin and with artificial intelligence and machine learning as it relates to what we're trying to do here at the Vision Institute, and really to apply that to clinical care as well as for research. But I think it's certainly a sign of things to come as it relates to how these tools can be applied. I, for one, am very excited, as I know and everybody, of course, in their own health. I have a history of macular degeneration in my family. At any time, I can, have somebody sit down with me and share with me where this disease may progress in a period of time, and I can have an informed decision about where my care can go. I think that's a wonderful thing and a wonderful option to give everybody. And I love how it's very personalized to everybody's situation and circumstances as it relates to their genetic history, their social determinants of health, and that we can also really gauge the safety of these therapies and these, and our care from that. So bravo for putting this together and getting us to this point. I do know also that this, gives us opportunities to grow um, our ecosystem here in Pittsburgh in terms of health and healthcare offerings, and that even this will provide an opportunity for us to have a new entity that'll be a commercial entity for the again coming right out of our institute. That's important as well, because those transactions, those opportunities, then make everything more available for patients. Anything to share as well about that stage where this project is going in terms of that component to it, the commercialization stage?
Yeah, thanks to Aloni and the team and all the donors. And I think that, we have pushed forward, and now we have spun out a commercial entity, which is helping us to, push this forward and collaborate with other people. Sorry, to collaborate with other people. And now we have a commercial entity, which is again being supported by friends and family and the family foundations, called Netra Mind Innovations. And I think that, we are just aiming, we are just treating that as one more resource to support our research to we can take this forward to literally to the community level.
Yeah, and those are the important steps that allow us to take something from an idea and concept that we're developing here at the University of Pittsburgh and essentially share it with the world. And I think that's always in our minds and in the minds of I know the teams here to try to work on these things so that everybody benefits.
Yeah, and the
So
goal is also to make it available for areas where there is no ophthalmology coverage and the underserved areas where people don't have access to good quality care, because obviously this is going to enhance the quality of care in academic centers and the top center, because it will facilitate the follow-up and the diagnosis and the prognosis assessment. But there are many places where we don't have access to specialists, and the plan is to make it available. So and this is why actually Richard Kimmelon was also supportive, because this is part of an equitable, sustainable model that we want to develop.
thank you. All right, I am not seeing any new questions. I think we've answered most of those that we can. There are a few that we will get back to some folks on, but thank you for joining us today for another edition of our Sight and Sound Bites webinar series brought to you by the Eye and Ear Foundation of Pittsburgh. And thank you both Dr. Sahel and Dr. Chhablani for your time today and sharing this with our audience. This will be recorded. And if you want to share it with any friends, you can be able to find it on our website at www.eyenear.org in just a few days. Thank you all, and have a great day.